Our project is on Elizabeth Blackwell, who was the first woman to receive a medical degree in America. Elizabeth was living in Ohio when a close friend of hers was dying from uterus cancer and told her that she would have been spared her worst suffering if her physician had been a woman. Elizabeth decided to save money in order to attend medical school. Elizabeth became a school teacher in North Carolina, which was a common and appropriate job for women at this time. Elizabeth organized a Sunday school for the slaves. She stated that she disliked slavery more and more each day and was determined to teach them to read and write. Unfortunately, this act of hers was unpopular, and the Sunday school teachings were unable to continue. After being denied by many medical schools, Elizabeth was accepted into Geneva Medical College in 1847. The request for a female to attend Geneva was so unheard of that all the students agreed on having Elizabeth in their class. However, Elizabeth faced many challenges even after being admitted into medical school. Elizabeth's anatomy professor did not want her to attend a lecture about the reproductive organs. Blackwell argued that as a student, she had every right and a privilege as everyone else. She wrote a letter to the class that asked for her acceptance to witness a dissection. Her professor was pleased with her dignified response, and she resumed lectures. During the summer break from school, Elizabeth studied in the hospital wards of Blockley Elms House, which is now known as Philadelphia General Hospital. The institution provided the first government-sponsored care of the poor. She was placed in the women's syphilitic department, which was the most unruly part of the hospital. She visited many wards of the hospital and got along very well with the nurses, but was ignored by most of the physicians. Many immigrants were brought to Blockley that had contracted famine fever. The hospital soon became overcrowded, and Elizabeth was heartbroken by the horrible conditions provided to the patients. The epidemic sparked an interest and led Elizabeth to focus her graduation thesis on the subject of typhus. The thesis was published in 1849 in the Buffalo Medical Journal. Elizabeth finished the rest of her schooling and graduated from Geneva in 1849 as the first woman to receive a medical degree. She then traveled to France, where she furthered her studies and gained experience before practicing in America. Elizabeth had a difficult time finding a hospital that would accept her as a physician. She finally was able to enroll in La Maternité, which was the world's leading maternity hospital. At this time, no hospitals or practical clinicals were open to women. By entering La Maternité, Elizabeth would be able to fulfill her objective of becoming an obstetrician. The young women were trained as midwives here, but had no prior medical schooling. Elizabeth was treated as a student midwife, not as a physician. While treating an infant in the infirmary, she had accidentally squirted contaminated water into her own eye. Her eye progressively got worse until she lost sight, and this ended her studies at La Maternité. Elizabeth had to take off time in order to recover from her injury, but in 1850 she enrolled in St. Bartholomew Hospital in London. Her ticket of admission granted permission to study in any ward, to shadow any physician or surgeon who was willing.
In 1856, Blackwell adopted an Irish orphan, Kitty Barry. Barry was brought up as half servant and half daughter. Diary entries at the time showed that Blackwell adopted Barry half out of loneliness and possibly feeling of obligation, and maybe even utilitarian needs for domestic help. Records show that Barry admired Blackwell and stayed with her all her life. Blackwell was particularly influential in illuminating the relationship between physical activity and the social desire of healthy, robust women. The domestic feminism of Elizabeth Blackwell were clear in her lectures entitled Laws of Life, with special reference to physical education of girls. These lectures argued for the need for physical education and exercise for young women. The tearing off of swaddling clothes, the encouragement of climbing, running, riding, dancing, and free play in childhood, freedom from strangling corsets, training in skills which would give her a worthwhile goal in life prevents too early a marriage, often resulting in invalidism. As discussed in class, the book Sex and Education, or A Fair Chance for the Girls, in which Dr. Clark discusses his views on the education for boys and girls. This caused a great controversy, especially among women's rights activists. Dr. Clark argued that girls would not be able to withstand the intellectual demands that were traditionally placed on boys. However, this is something that Blackwell would never have agreed with. Elizabeth returned to the United States in 1851 and settled in New York City, where she hoped to establish a practice. In 1853, Blackwell opened a small clinic in New York for poor women and children. In 1857, Blackwell, along with her sister, who had a medical degree, expanded the clinic into the New York Infirmary for indigent women and children. Elizabeth believed that women should receive their medical education alongside men in the established medical schools. However, she understood the gender bias that existed within education. Since women were trained in her infirmary were not able to gain admission to the male colleges, she was persuaded to establish her own women's medical college. The year after the college opening, Elizabeth left for England, leaving the college under Emily's control. So in 1869, Blackwell left New York as she felt that the pioneer work in America was over. In 1874, she established a women's medical school in London with a former student, and after that establishment, she was elected as a lecturer in midwifery and resigned this position in 1877, officially retiring. Blackwell's greatest period of reform activity was after her retirement, from 1880 to 1895. She was interested in a great number of reform movements, including moral reform, hygiene, medical education, eugenics, family planning, and women's rights. She died in 1910 after a fall in 1907. In her lifetime, she not only broke the barrier to becoming a doctor, but she opened the door for many women to come. Her graduation as the first woman doctor of medicine in America is one of the proudest women's history moments. Her life represents a historic moment in medicine as well as women's liberation. Blackwell was able to overcome prejudices to pursue an education. Furthermore, she used her platform for social and moral reform. In addition, her legacy lives on. The Elizabeth Blackwell Medal, created as a lasting tribute to the first woman awarded with a medical degree from an American medical school. This is granted to a woman physician who has made the most outstanding contributions to the cause of women in the field of medicine.